Our next lesson is on the reasons why some women do not ovulate. In our last video, we all understood that there are signs for ovulation. And so if you follow up yourself and you don't have any of these signs, it may mean that you do not ovulate. What are some of the reasons why some women do not ovulate? Some women are mature enough, some are even married, but they might even be menstruating, meaning that they see their monthly flow, their menstruation. They may even be menstruating, but not ovulating. What are the reasons why some women will not ovulate? How will you even know if you are not ovulating? What could be the cause? We have at least 8 points, at least 8 reasons I would like us to discuss. If this is your first time watching me, you are welcome. Please click on the subscription button, like and share. You can make your comments. This is Dr. David Reproductive Health. And my name is Dr. David. I am a reproductive health expert, and I hold a PhD in public health. I am coordinating the understanding of this lesson. What are the reasons why some women do not ovulate? 1, menopausal, age. Somebody has reached menopause. Somebody is in the pre-menopausal stage or period. And the number of follicles in her ovaries have drastically reduced. And so some months pass by without ovulation occurring. It could just be that the woman is aging as far as reproductive life is concerned. Number 2, some women are on contraceptive pills. We are talking about hormonal contraceptive methods like combined oral contraceptives and even POPs, progesterone only pills. Once you are on these pills, one of the first actions, the mode of action, is that they stop or prevent ovulation. And so some women may not be ovulating because they are on certain agents or certain drugs like this one. Number 3, Polycystic Ovarian syndrome. Some women suffer from what we call Polycystic Ovarian syndrome, meaning that the ovaries have developed cysts that are multiple in number, that are many. Poly means many cysts, which are abnormal growths, overshadowing, overpowering the normal functioning, the normal anatomy and physiology of the ovary. This, in most cases, prevent the woman from ovulating. When they tell you that they have diagnosed ovarian cyst, sometimes these women with polycystic ovarian syndrome, they do not ovulate. It is an obstruction by this growth, this cyst. Number 4 reason, premature ovarian failure. Sometimes we notice that some women, they do not have follicles that can ovulate. Whereas while growing as young girls, these follicles were there, the special cells in the cortex of the ovary. You will now remember in one other video, just get down to search, you will get the video I taught the menstrual cycle and even explain what happens between the brain and the ovary. We made it clear that a young girl is born. By the time it's born, she already has a steady number of, follicles, the special cells, which are like seed. They sit for human nature, human being. And we said the normal range is between 200,000 to 400,000. in the ovaries of a lady. Now, they remain primitive until a girl has reached puberty. Puberty is the age of sexual maturity. Some girls these days reach puberty as early as 9 years, 10 years, 11 years, 12 years. So let's take this example, that this lady started ovulating when she was just 10 years. Studies tell us that in 1 month, before you find the ovary to release an egg, a number of these follicles are growing like 20, 25 or more, only to give way for one to be released as a mature egg at the end. When one is released at the end, the rest, they die. They dry up. They become arthritic. You understand? And that, for one egg to be released that month, she has wasted 25 or 30. And that's only 1 month. If about 25 follicles are destroyed only in 1 month, by the time she will have menses, or she will have to ovulate 12 times in 1 year, because there are 12 months in 1 year. If he has to go 12 times, it means that about 25, 30 follicles times 12 have been destroyed in 1 year, when she's still 10 years. By the time she'll be 11 years, how many have been destroyed? By the time she's 12 years, how many have been destroyed? But in our context, like in Africa, a lot of our children are 12, 13, 14, 15. We say, no, my baby, it's still too young. Whereas nature has said she is mature. And the number of her follicles are flowing, are going. Some of them, by the time they reach 35 years, 36 years, 40 years, they are finished. All follicles finished. Can she reproduce again? No. I have personally witnessed cases of ladies that have concentrated in school, and somebody say, I want to have my master's degree, I want to have my PhD before I start having children. Not knowing that time is not on her side, and she's menstruating every month. She didn't know this science. And this lady even finally had her PhD before 35 years, and then she got married. But baby did not come. They started moving, and we only discovered that follicles finish in the ovary, meaning that she has reached. In fact, we don't refer to that premature menopause. Yeah? Simple. You have just reached premature ovarian failure. Sometimes the ovary completely fails to function. Now, number 5, diminished ovarian reserve. When we talk of diminished ovarian reserve, it is a case where this number have gone too fast, like I've described here, and the lady has been for too long without a pregnancy. You know, if a lady even gets pregnant, the pregnancy implants in the womb, the level of estrogens and progesterones will be very high, because these are pregnancy hormones. When they are high in the system, they block the brain right from the hypothalamus. And so follicle-stimulating hormone cannot be secreted again. Luteinizing hormone cannot be secreted again. And so the ovaries go dormant. And if this pregnancy has to be for 9 months, means within 9 months, no follicle shakes. They remain reserved. But her own classmates, her own friends who are not pregnant, within 9 months have lost hundreds. Within 9 months have lost hundreds of their follicles. But her own hundreds are reserved, because during that time her system was occupied with pregnancy and the ovary was not ovulating. My dear sisters, brothers, listen and listen good. Get knowledge that will help you to take decisions in life. Nature, we are teaching here reproductive health. Nature tells us that when you have gotten to reproductive age, mature age, try and make hay while the sun shines. I wish my daughter between 18 and 20 brings a suit up, or we are happiest man. So that between 20 years, 30 years, she has already given birth and stopped. Why would you even get up 30 and you're still thinking of giving birth? Yes, because there is something that nature says. I am teaching this out of experience. You might not find in any book. The experience of the many years I have worked on reproductive health. When a lady starts ovulating for the first time, remember, first menses is called menarche. First menses. When a lady, since she grew as a young girl, the very first menses she had is called menarche. If a lady has menarche, nature gives you 15 years of grace. You are normally supposed to reproduce within 15 years. But ignorance makes a lot of us want to reach 30, 40 before we think of having a child or two. When by nature, it is very late. Now, within these 15 years, nature tolerates any shit that you bring, that you cause, any worry. Every month you are menstruating. You think that when you menstruate, I thought the menstrual cycle, I say the flow of the blood that's coming out from your vagina, you're buying pad and wearing. When you're buying pad, you are telling your nature, you're telling your womb that I'm sorry, I'll not do this next month. Because the bleeding, we describe it as the weeping of a disappointed uterus. The uterus in a normal situation doesn't need disappointment. So if you take your decision that no, I want to have a baby at this and that age, means every month you will be disappointing your womb. So be pleading for womb to have mercy upon you. But the womb gives you up to 15 years of grace. Now, what if the girl started having the first menses when she was just 10 years? 10 plus 15 will be what? That's 25. Means that if she's more than 25 years and had never been pregnant, even once, she stands high risk of having reproductive troubles now in the womb. You start seeing young girls, they are operating high in the hospital for fibroid, for ovarian cyst, this complaint and the other. And because the womb gave you 15 years of grace and you didn't give the womb even one time something to hold and feel satisfied and thank you, now it has decided, it has gone vexed, want to start producing its own things and hold it. What is your problem with it? That is why the risk of even making baby after your 15 years of grace, the risk is higher. But somebody who started having her first menses at 14 years, 14 plus 15 is 29, means she has up to age 29, where she's very safe. But above that age, anything that the womb brings, accept it and thank God. That is it. Take reproductive health principles so you make your decisions within that limit. And you are going to be very safe. Now, the next cause, hormonal imbalance. Certain hormones, especially like a follicle stimulating hormone, luteinizing hormone, when their levels are not balanced, the woman is not going to ovulate. Just know that imbalance of hormones is a great trouble. Number 7, hyperprolactinemia. Sometimes the hormone we call prolactin is high. The levels are high in blood. Once they are high in blood, they block right from the brain. They block the production of follicle stimulating hormone. They block the production of follicle stimulating hormone. And so the ovaries remain dormant. They cannot ovulate. And then we call some that unexplained. That's number 9. Unexplained anovulatory cycle, meaning some don't even, we check everything until we just say, well, only God knows why this one is not ovulating, because there are some that are not ovulating, but you search all the direction, there seems to be no problem. Yes, it is acknowledged that there are some that we call unexplained anovulatory cycle. My dear brother and sister, go to the hospital, see your doctor anytime, any day, when you suspect that you are not ovulating. They are there in the various hospitals. They can help you anytime, any day. Thank you. Next time on this video.